talk about readiness for surgery and all the reasons you might want to put surgery back apart from the obvious ones. So, which are the requirements, which oftentimes your insurance company will need and will need to have documented before surgery. So first of all, I'm a surgeon. I absolutely love to operate. I'm the last person who wants to delay things. And I can only imagine what it's like to be in your shoes where you've waited all your life for this surgery. I had one lady in my office last week who told me she's waited 52 years for her surgery. So, but I just want to talk about making sure the time is right in order to proceed, because there are things on the line. There's certainly things on the line. There's your health, first of all. You have to be fit and healthy and well enough to undergo the surgery to make sure something really bad doesn't happen. And then number two, when we're creating something new, we want to make sure that be it nipples or a new vagina, that you're going to be able to take care of them. So sometimes you just have to take a step back and say, well, maybe I'm not fully right and ready yet for this surgery. So some of the top things we need to keep in mind is where you're going to stay after surgery. So just making sure there's a safe environment at home and you're going to be able to dilate if you need to dilate, or you're going to be able to take care of those nipples and you have a clean, safe place to do so. So that's crucial. Number two, support. You really have to have some sort of good support. And this can be a tough one because at various points in your life, there may not be somebody who is available to bring you to and from appointments, but you're not going to be able to drive home when you leave the hospital after your surgery. You're going to have heavy pain meds on board, and this may also be true, depending on the surgery, for your post-op visits as well. So you're going to need your person. You're going to need somebody to help you out with that, would be number two. And number three, so finances. So as much as possible, we try to do surgeries through insurance, but there's always costs patients don't necessarily always think about. And those would be things like dressings, medications, and of course the deductible. So depending on the type of insurance you have, you may have to pay a certain amount yourself. And this can be even true for the Medicaid type programs. So you want to make sure that you're going to be able to afford your care as well before planning gender affirmation surgery. We could talk about readiness all day. Those are the ones sometimes people don't necessarily think about. And I've oftentimes seen a good responsible primary care provider, or maybe hormone provider, even mental health professional, may put the brakes on a little bit, when a patient wants to get their surgery immediately, because we don't want to put your final result in danger. We want to make sure you have a good functioning vagina, you've got normal looking nipples at the end of the day. So sometimes just keep in mind it may not be the right time and that you should wait for surgery.